while that's all connecting, I want to thank everybody for coming in and watching The Art of Mindful Medicine, an introduction to our health and wellness practitioners. My name is Dr. Seth Gilson, and my guest on this episode, which is the part 2 of episode 3, is Ilyas Hamid. Ili has been a trainer and nutritionist in the past. He's trained in traditional Chinese medicine, and he is an acupuncturist physician. For those of you that didn't see part 1, which you should check out on my YouTube channel if you haven't already. The Art of Mindful Medicine is the name of the YouTube channel, and my website is www.mindful.doctor. All right, so we're going to jump right into it because this is part 2.
I'm here.
Awesome,
Can
awesome, awesome. So I'm pretty sure I know everybody can hear you. So some of the questions that we had from the first episode is what I want to start with.
okay.
So let's start with how to balance a healthy diet with the diet of your culture, because we know that varies.
Yeah, I think the big takeaway here is how important subjectivity is. How we need to look at our bodies from an individualized approach.
Mm-hmm.
So in Chinese medicine, they believe that where you grow up, where you were born, you should eat what's native to according to your environment, right? So
Yeah.
if you live in the cold in the tundra, you want to eat more types of foods that are going to keep you warm. You're probably going to
Mm-hmm.
salvage some food for the winter, lots of soups, lots of things like that. If you
Mm-hmm.
live in a hot environment, you're probably going to want to eat more tropical types of foods to keep
Mm-hmm.
you cool. The types of meats in the tropical environment would be considered like fish and things like that.
Mm-hmm.
So as far as eating for your culture goes, the big thing is people want to default to what's a native, but we have to remember our subjectivity. We have to remember our current state of health.
So then the next question was is how Eastern medicine applies to dentistry. And of course, I'm going to let him answer that because I'm not as familiar with Eastern medicine as is Illy. But being a biological dentist, I do know that we have taken a lot of different approaches to dentistry and overall medicine, because that's what biological dentistry is. Biological dentistry is not a specialty or anything like that. It is a practice philosophy, and it's not just dentists. It encompasses working with primary physicians and other doctors as well. Biological dentistry is observing and looking into how the oral health plays in line with systemic health, and vice versa, how systemic health plays with oral health, and how they are one and the same. I mean, I was just reading some research on leaky gut and gastrointestinal issues and things like that, and how you can the first signs that there's something going on in your GI is inflammation of the gums. So when the gums are inflamed, it's a very good sign that your immune system is overactive. And when your immune system's overactive like that, you're going to have a lot of inflammation because, well, why is your immune system active? Because of the amount of bacteria and inflammation that's in your mouth already. So when your immune system is fighting that bacteria to create balance of the microbiome in your mouth, all of that translates all the way down to the rest of your body. So it's really taking a more of a whole body approach and looking at the entire human, not just from the neck up, because it's all connected, right? I mean, to me, it's just dentistry, but that this is how things have developed and evolved over the years, and it is like I said, it's not a specialty, but it is a different practice philosophy, which is not anything new. It's been around since 1984 is when the IAOMT was created, and it's a nonprofit organization, international nonprofit organization that actually conducts a lot of research, and it's on all the things going on in dentistry, whether it's materials, from not just materials, but also other types of research studies, whether it's the impact of fluoride and how fluoride was very not very well researched before it was actually implemented into water systems and things like that. How the metal fillings and the mercury in metal fillings affect not only the patient when it's in your mouth, but how, when they're being removed, it affects the dentist and the dental team, and the best ways to go about addressing those issues. So if anybody has any questions about biological dentistry, or just dentistry in general, please definitely check out the page, check out my website. Feel free to ask me any questions that you may want. We'll see what he does, and hopefully he gets in here in a few minutes. But like I said, feel free to, can I share some info about your experience, about my experience with acupuncture? So that's a good idea. I like where you're going with this, Illy. My experience with acupuncture, not with Illy, this was at another chiropractor's office. How many years ago? I don't know. Maybe 4 years ago, 3 years ago, something like that. And it was a traditional chiropractor's office. Who I knew the doctor, but I did not know the acupuncturist. I had never been introduced to acupuncture. I mean, literally all I knew was needles that go into your skin. That's all I knew about it. Which didn't sound too pleasant at first, but people had told me prior that it is not painful and you feel very little to nothing. And when I was at the chiropractor's office, my buddy asked me if I wanted to do it as part of the treatment, and we went over some of the risks and benefits and things like that, and I said I would do it. And when I went for my first appointment, the woman interviewed me, and she went over my medical history and went over some things about acupuncture, but it wasn't very personable. I don't think to me, it wasn't very thorough. She didn't really explain what she was going to be doing. Like I said, I just knew that needles were going into my skin. She wanted to know like where my pain areas were and things like that. We didn't discuss any of the channels, the meridians or anything like that in our body. And then got me on the table maybe 20, 30 minutes later, laid me down, put the needles in, put a little music on, and then she left. And I was just like, I didn't even know how long I was going to be sitting there. But no explanations as to what was going on, no nothing. And it must have been, I don't know, 20 minutes, something like that. She came back, asked how I was doing. It was not painful, by the way. I maybe once or twice I felt like a tiny little pinch, but for the most part, didn't really feel anything at all. Then she came back in, took the needles out. I don't recall there being any kind of bleeding at all. And she just wanted to know when I wanted to make my next appointment. So it wasn't, in my opinion, a great experience. I didn't really learn very much of anything. I didn't know what to expect. It just, to me, it was more about, it was a much more corporate situation. It seemed that money was much more of a pressing issue. Pachi Woodard. I have been around acupuncture my entire life. In Brazil, acupuncture is part of our health system. Chinese herbs and acupuncture were fundamental to keep energetic balance during tough times. Makes total sense to me now because I've looked up a little bit more, and obviously knowing Illy, who I'm going to bring in here. There we go. Look at that. Look at that beautiful human, everybody.
Finally,
with the daggers and swords and nunchucks in the background. I love it. No, that's perfect. I don't mind that. Hey, that's Chinese and kung fu tradition. I'm sure you've trained with those things. So
yeah,
John, that's right.
Kung Fu and Chinese medicine, like they go hand in hand. They came up together.
Awesome, very awesome. All right, so obviously I was just talking about some acupuncture. Thanks to you, that was a great idea, and also how Eastern medicine views dentistry.
I heard what you're talking about.
Yeah, I'm sure you were laughing too.
That doesn't do a really good justice for Chinese medicine and acupuncture.
No, it does not. So let's like I said, let's get to these questions, and then the next question is actually about acupuncture. So then I'm going to let you take off on acupuncture. But when it comes to Eastern medicine and dentistry, how do they intertwine?
Okay, yeah, we talked about this last week too, but I guess we were going in and out.
Yeah.
So actually, in Chinese medicine, the teeth pertain to organs as well.
Mm-hmm.
Yeah. There's actually like if there's something wrong with a specific tooth, it pertains to a specific organ.
Mm-hmm.
Now it's not something that I've gotten too much familiarity with, but there is a whole field obviously associated with
Mm-hmm.
that. Um, I think obviously it pertains to like the energy channels going up in the teeth. So like if you have something wrong with your stomach, and you look at the tooth that's associated with it, you can use that actually to diagnose what's actually going on with the stomach. Something will be wrong with that tooth.
Mm-hmm.
So
No, that makes perfect sense to me. I mean that actually, the doctor that I'm currently working with, she's been a biological dentist for, I think, over 20 years, and she actually has the meridian chart with the teeth on it, that she goes over with every new patient for an exam, which is
oh
really
wow,
great. Yeah.
yeah,
So I'm going to be learning a lot more about that. I'll obviously definitely go over with you.
yeah.
And I mean, she was even telling me stories how people if they've had infections or root canals with infections, she takes the teeth out. Sometimes she won't even put implants in because if there's a cavitation, or something else going on with the bone's not very good quality, she won't even go as far as replacing the tooth because the success rate is so low due to the condition or infection that was previously there.
I think
So
that's very wise of her.
yeah.
But I think this is where we ended last week, where we were talking about our paradigm of health,
Mm-hmm.
the way we view health in our country. A lot of it is about aesthetics and being young forever, looking young forever, um, instead of aging gracefully, right?
Yep.
So for a lot of people, for many people in our country, like if vanity is more of a concern, then she may not be the dentist for them. But if your ultimate health is of concern, then she might be the best.
Yeah.
I would work with her.
Yeah, that's why I'm choosing to learn with her, because it's actually been a really cool experience for me because I come from a more a yoga background and traditional sports medicine, whereas she's just traditionally trained as a dentist, but then has been now in biological dentistry and obviously studied alternative and more holistic methods over the past 20 something years, which has been fantastic. So
Yeah,
it's really been a really good exchange.
yeah, she would be a great mentor.
Yeah.
I'm interested in learning from her, see what
Yeah.
she's got to share, and see how I could apply acupuncture to it too. You
Hmm.
know?
Yeah, for sure. Absolutely. Okay, so speaking of acupuncture, so acupuncture and mental health was a question. So how can acupuncture help with mental health? And I know this is something that you more or less see quite often. So,
Yeah, in Chinese medicine, and this kind of goes into the root of health. Chinese medicine has a viewpoint that anything that happens on a physical level pertaining to health is affected by the mental level, which is affected by the energetic level, which is called the chi level,
hmm.
which is affected by the emotional level, which is affected by the spiritual level. So the deeper the deeper you go, that's the deeper the root.
Hmm.
So if you have like an emotional issue, a trauma or something that has just not been resolved, it will affect your energy, which will affect your mental outlook on life and how
Hmm.
you interact with others,
Hmm.
and that can eventually affect you physically as well. So, for instance, um, if you're stressed out, right, body language goes like this. Okay,
I know all
like
about that.
stressed out, kind of hold it in our shoulders sometimes, you know. Um, Long term, holding that stress right here. Look what happens to my neck.
Hmm.
All right. So there comes this tension and this tightness and this pain in the neck, and then the muscles get locked up in that area, putting tension on the vertebrae of the spine.
Hmm.
So you might find people with a lot of like herniated discs and things like that, and then you go and you ask them the emotional questions, and oh, I'm so stressed out from work. I don't like my job. I'm not happy at home. Whatever, and like, it's kind of like opening the lid of all this stress, and then you can physically see them go.
Yeah, yeah, 100%. And to be perfect, I mean, to be completely transparent, you just described me. Like, I'm not even kidding. I mean, I played soccer my whole life, so I mean, I was always over. I was a goalie, so I was bent over like that, anyways. But the past 10 years and in dental school, I mean, that's a very very stressful time in our lives, and I
Yeah.
was always like this. My posture is always. I've been the last couple of years. I've really been working on it. The last year and a half, I've really been working on it. And like you said, opening this up,
Mhm.
it makes a huge difference. I mean, that whole curvature you just said with the cervical spine. I have C5 C6 herniations. So I mean,
I mean,
you're dead on with what you just
yeah.
said.
At school, it was really cool going to Chinese medicine school because everyone wants to practice on each other. And
Yeah.
you would walk in the lunchroom and everyone's giving each other massages. And I found that everyone that I ever gave a massage to in school had the same knot in the same spot. It was right inside of the scapula.
Uh huh.
I called it the student knot, the student tension,
Yeah.
because I was,
That's right where it is.
yeah.
Right between the vertebrae and the scapula, right in there. It's I know exactly what you mean.
But if you think about what that does, think about what the vertebrae being compressed does.
Hmm.
The vertebrae is your neuromuscular system. So this is electrical signals being sent out to your body. If these get pinched, those signals can't be sent out.
Exactly.
There's a lack of circulation happening in your body
Yep.
because chemical signals aren't going to get turned on from the electrical signals.
Hmm.
It cascades from there.
Yeah.
If you can't get good blood flow to your body, you're asking for trouble.
Yeah, and to it, I mean, and you can talk about it from a Chinese standpoint, but to me, when you have those blockages, those physical blockages, that therefore the energy can't flow as well either, and that can absolutely affect. I mean, just the discomfort alone will affect your mental state.
Absolutely.
So,
Exactly. Just being like that, it's like a vicious cycle, right?
hmm.
Like I hold the tension here from stress and it actually ends up causing migraines and the migraines make things worse and
Yep.
you
So
go for a massage doesn't help,
yeah, it to me it was very temporarily it helped,
Mhm.
but it just was never a lasting um,
Yeah,
therapy, I
exactly.
guess.
And that's what I mean by that. I think that's another aspect of our paradigm here in America is like we do the temporary approach. Really putting the band-aids on things
Hmm.
instead of looking at, oh, I want to be optimally healthy for the rest of my life instead of, okay, I'm just going to get through for the week,
Hmm.
get this massage to get me through for the week or the couple weeks or so.
So how does acupuncture address that?
Address,
The
oh,
like the curvature of the spine and the dysfunctional energetic flow.
it's a really beautiful thing, man. You can actually like reprogram your nervous system
Hmm.
with acupuncture because aside from the energetic aspect, we are actually manipulating the electrical central nervous system.
Hmm.
So every time you put a needle on a person and it creates this state of release, that's causing a new neurological pathway in the brain.
Hmm.
So instead of the brain going into that state of stress and tension, we're creating a new pathway that causes release,
Hmm.
endorphin flow. It creates this new feel good pathway. And the more you do it, the more that pathway gets stronger.
That makes sense.
So
Go ahead.
yeah, so and that's just one of the benefits of acupuncture. It starts to restructure the way your brain works.
Hmm.
That's really like on a deeper level. It's causing profound change.
Yeah, absolutely. And one of the things you had said in part one, I know, and to me that this makes all the difference in the world, and this is why the practitioner that we choose is so important. For example, like the story I just told, you said when you put the needle in, you're transferring energy. So the energy of the practitioner, the way I took it from what you described, the energy of the practitioner is going into the energy of the person you're working on, and that's going to affect the whole energetic flow, I would imagine, as well.
Absolutely. So when I went to China in 2016, I interned at the Shaolin Temple with Shaolin monks.
Hmm.
Um, we had doctors there. One of my teachers was Vladimir Putin's acupuncturist.
Oh, that's yeah. No, you told me that. That's right.
Yeah, he was the second doctor in charge, but the head doctor in charge, he was they call him the abbot. He's like the head, the head monk.
Uh huh.
And he said to us that he doesn't treat anybody unless their heart is open. Because anytime he puts a needle in a person, not only is he giving his energy into that
Hmm.
person, he's taking their energy as well.
Exactly.
So he's very discerning about like, okay, I don't want to treat this person. This is too much for me.
Yeah.
Um, but they also said, like when you do take that energy, you can feel it. You can, if a person puts a needle in you and they're not being soft and attentive and careful to your body, you can feel that.
Hmm.
If a person is just like, okay, let's just put these needles in here, and they're not being attentive, it can be very frightening for the patient. It can cause them to lock up and things like
Yeah,
that.
absolutely. I mean, that was one of my biggest deterrents initially. I'm like, somebody I don't know is just going to put like 100 needles in somewhere in my body. Like, it just, I definitely want to have a some kind of a personal relationship with the person doing it beforehand. So
It's huge, and even that translates also into like the medical field too. Like if you don't feel comfortable with your doctor, how open are you going to be with this person?
yeah,
You know,
absolutely. Yeah.
I think this part is like a very profound part of medicine that just doesn't get taken account of anymore. Is the client practitioner relationship,
Hmm.
cultivating that.
Yeah, which is basically why I started this show. So that way people can meet different practitioners, and the practitioners can, in some way or another, kind of introduce themselves to people, which is what we're doing right now for you. So,
Yeah,
um,
if anything, a lot of people ask me to do interviews, and I'm like, this is fun, but for me, this is more about educating people
mhm,
because the paradigm pertaining to health just needs to shift.
yeah,
If we're really going to get people in a healthy state, and if you're healthy mentally, emotionally, physically, you can interact with others in a more healthy way.
yeah,
That
absolutely,
harmony in your environment, and it all starts like within how we view ourselves, how we treat ourselves, and that's all mental emotional health.
hmm. So, which kind of comes into the next question was about acupuncture and inflammation, which I'm sure it works in a similar way with the energy channels. But I'm going to let you explain a little bit more about how acupuncture can influence and relieve inflammation in the body.
Okay, so yeah, so when it comes to inflammation can be for so many different reasons. It can be you can have inflammation from heat in Chinese medicine. You can have inflammation from damp accumulation in Chinese medicine, which just basically means swelling.
Mm-hmm.
Um, the inflammation is very easy to treat. You can always treat the inflammation. So let's talk about. I think we had this discussion as well with with talking about teeth.
Mm-hmm.
If a patient comes in for they have some kind of disease that's affecting their gingivitis or something that's causing pain in their mouth,
Mm-hmm.
and that pain is the inflammation, right?
Mm-hmm.
We do acupuncture on it. Yeah, we can get rid of the inflammation. The pain will disappear, and that's great. That's easy for us, but that's not where we need to stay. We have to go further.
Mm-hmm.
We have to address the gingivitis.
Mm-hmm.
Otherwise, it's just going to keep coming back.
Yeah.
And that's what I was talking about when it comes to the paradigm of health is how are we viewing health? Are we looking at it from this quick fix, magic pill band-aid approach, or are we going to do what we need to do to like fully resolve what we need to?
Mm-hmm.
And how does that translate into finances, right? Like it actually saves money in the long run.
Oh yeah, absolutely. I talk to patients about that. I mean, those that are open to it, I talk to them about that all the time. Preventative medicine is far less expensive than reparative or reactive medicine. Definitely.
Exactly. If you fix everything now, all you have to do is maintain.
Yeah.
And just like the gym, if you're trying to get down to 15% body fat and you're trying to build so much muscle, you have to work really hard to get there. But once you get there, all you have to do is maintain.
Mm-hmm.
It's the same thing with health. Like
Yeah.
do what you have to do to get yourself fully resolved, optimally healthy,
Mm-hmm.
and then just maintain.
Yeah.
Life
I
is
mean,
so much more that way.
yeah, it is a lifestyle change. Um, I don't want some people to think like what you're saying is like, well, you just get to a point and then you can just go back to doing things how you used to. I mean, you also have to maintain that new lifestyle which you've created for yourself. So.
Exactly. And that's how it's supposed to be, right? Like, and that's why we have all these recommendations, like eat this many fruits and vegetables a
Mm-hmm.
day, exercise this much a day. That all pertains to just maintaining.
Yeah, absolutely.
But, but a lot of people aren't going. They're not doing enough to get to that point, and a lot of that is cultural.
Yeah, that makes sense. Um, so real quick, I wanted to be sure because I honestly don't even know the answer to this. When you were talking about addressing inflammation in the mouth through acupuncture, do you guys actually place the needles in the mouth, or
No,
is it
there
somewhere else?
there there are some acupuncture points in the mouth, but there are needles all like you can put a needle in your finger and it will affect your neck.
Yeah,
It will neck. There are points all on the legs that we can treat for like gingivitis and like any kind of gum type of issues. So no, not necessarily. Although there are points in the mouth.
okay. Um, what are some of the different what are some of the most common points that you find that you use in your practice for people? So like most people kind of get an idea of what they should expect when they.
Well, this goes into the theory and the diagnosis. So in Chinese medicine, when we're talking about the mouth, or especially the gums,
Hmm.
we're talking about the stomach channel. Usually, a person will have some kind of stomach issues that will show up and manifest itself in the gums.
Yeah,
So we would use the stomach points
that
to
makes sense,
resolve.
and that's what I was just talking about before. I mean, before you were able to get connected on here, I don't think you heard it. I was reading up on some things about leaky gut and inflammation yesterday, and a lot of research has been showing that the inflammation that goes on there, because that's all that really is just inflammation of the GI tract, and how that translates to the inflammation in the mouth.
Oh yeah,
So,
that's actually what I was going to do some of my research on
hmm,
was leaky gut, intestinal permeability.
yeah, that's a huge issue that's widely or vastly misunderstood or not understood at all. I mean, most people don't have never even heard of it,
Yeah.
and it's probably I don't know if I don't want to nobody quote me, but I want to venture to say that most people are probably have some sort of leaky gut issues, especially in the United States.
Oh yeah. Okay. So I always give my patients this spiel.
Okay.
So the way leaky gut works is in the gut lining you have these villi
Hmm.
based on all the way at the bottom, and in between the villi you have proteins connecting them.
Hmm.
Okay. What happens is when your body is incapable of breaking something down, it will affect the villi. It can actually, it can. I'm looking at how.
Hell, I know.
Yeah.
Uh,
Um, so basically, I'm gonna try to make this quick because time.
yeah, it's
So
okay.
basically, when you eat certain foods or if you're under a certain amount of stress, it can actually break down the protein,
Hmm.
and bacteria can get inside the lining of the stomach.
Hmm.
When that happens, the body sends an autoimmune response to that area. It starts to increase that inflammation.
Oh, and he got disconnected. Right in the middle. All right, so I'll wait for him to come back. Um, I know he was talking about the GI tract and how the microvilli are affected via inflammation and the proteins break down, and that's how the GI tract gets infiltrated. And you actually, it's leaky gut. It's literally like your gut is unable to absorb the nutrients, and it leaks um, through, and you get infections in your gut that way. Are there known foods that cause this? That's a good question. I'll see what Ilya has to say when he gets back in here. But there are some foods that are more causative to that. Highly processed foods, high sugar content foods, especially processed sugar, not so much natural sugars. Gluten and dairy are the main culprits. But like we were just saying, I mean, inflammation in the mouth, basically our mouths are essentially just a snapshot as to what's going on to the rest of our gastrointestinal tract. That's what we're talking about when I say GI tract. That's from the mouth all the way out to the other end. So it's all connected. And if there's something going wrong, or if there's inflammation in one part of it, then there's likely to be inflammation in another part of it, because it's all microbiome, which a microbiome is basically all of the bacteria that make up our gut. Because I mean, we have different microbiomes depending on what organ system we're talking about, but of the gut, the microbiome there is very delicate, and it's thousands and thousands and thousands of bacteria. But when you aren't feeding those bacteria the good things, the more dangerous or more inflammatory causing bacteria kind of take over, and it loses the balance in the microbiome. So avoiding things like if you have gluten sensitivity or just gluten in general, dairy is definitely one of them. I mean, I know via a lot of the research that I've read, casein is the main protein in dairy, and most people don't even have the proper enzymes to break down casein. So there's just an underlying low level inflammation that most people have due to dairy. And some people are just totally lactose intolerant, but some people might not necessarily have symptoms of it right away, but it'll happen many like years later.
So you know what I saw what Patty said, and I'm going to try to make it as quick as possible
Uh
because it's really important. It's best to just cut out all dairy, gluten, caffeine
huh. Mm-hmm.
for a little whiles until your gut can heal up,
Mm-hmm.
and then you can reintroduce it every once in a while.
Mm-hmm.
Because sometimes if you even just like a gram of gluten can
Mm-hmm.
affect your digestive system for up to 9
Yeah.
months. This is a big deal. So it's best to like allow it to just eliminate it from the diet so that your body doesn't attack itself and it can.
Like you said, let things heal first. So eliminate these things. Let whatever's going on heal, and then every so often it's you can add these things back in. Again, it's just about keeping the microbiome balanced. Um, yes, Mom, I know you're not going to stop drinking coffee. I understand. So when the microbiome is out of balance, that's when you're more likely to have more inflammation. Yes, the coffee conversation is definitely a big one, Illy.
Conversation,
All
man.
right.
It's like uh, it's trying to take the bull by the horns with my
Right?
patients times. It is the factor. It's that little thing that changes everything with every single one of my
Mm-hmm.
patients. If you've been drinking coffee for every day for however many years, for
Mm-hmm.
sure you have adrenal stress, adrenal fatigue.
Oh
For
yeah,
sure.
that's a whole other the amount of adrenal fatigue and things like that. I mean, especially in this country. I mean, I know that's a huge issue. So
Yeah, you know, the thing is what people don't recognize, what they don't know is that coffee, caffeine is a narcotic.
mm-hmm.
It's the
Yeah,
only global legal narcotic.
yeah,
Yes, because it affects your hormones in your body
mm-hmm.
and it's so addictive. So, like, if you try to get off of coffee, you know, you're going to have some withdrawal symptoms.
Yeah, absolutely. To what he just said, I remember when I was finishing dental school that I was drinking coffee every single every single day, and when I stopped, when I finished dental school, I want to say, I don't know, less than a year from there, I weaned myself off of coffee, and for me, it was the best thing I've done. So,
If you could just get a hold on managing with dairy, gluten, and caffeine,
mm-hmm.
your health will dramatically increase in like a week.
Yeah, that's the other thing. It heals really fast.
Really
Yeah.
fast. If you stop putting in the things that are basically poisoning your body doesn't have to fight so much anymore. It doesn't have to be so inflamed anymore.
Yeah, and the body knows how to heal itself. You just have to give it the right nutrients, environment, and love, really. That's
Yeah, and you know, after that's all over, you can introduce it because life isn't about eliminating these things forever. It's about enjoying it appropriately.
mm-hmm.
So whenever I have a cup of coffee, I don't drink coffee at all, maybe like once or twice a year. But when I do, I make sure it counts,
Yeah.
you know?
Well, that's true. I mean, I was reading something last week. There was an article. You do things, whether it's when you work, whether you play, whether you eat, or when you rest, whatever it is. Doing it at 80% is doing yourself it's being unjust to yourself. Do everything that you're doing at 100%. When you're working, work 100%. When you're exercising, exercise 100%. When you're eating and focusing on your nutrition, focus on what you're eating at 100%, being very mindful of what you're eating. And when you rest, really rest. Rest at 100% capacity, because doing those things fully and completely are going to allow you to do the other parts of your life much much better and much more profoundly. So, yeah, root causes of illness.
Yeah. So I'm going to open up Pandora's box here, and we're going to have to close it really shortly. You know, um, so when it comes to the root causes of the illness, I think in the Western medicine, we tend to just focus on the biological level.
Hmm.
You know, um, but in Chinese medicine, there's a whole concept of health that pertains to everything that is non-physical,
Hmm.
that the things that you can't see that affect your health, which
Hmm.
is like your what's going on inside of your heart and what's going on with your connection with like the universe or God or whatever.
Hmm.
If you're unhealthy spiritually, which means you're not content with your life, that
All right, Illy. So, what I basically want you to do, give a quick recap of your business and where you're located at, some of the best
okay.
ways to get in touch with you, and then different ways on social media that you're available.
Okay, I'm in Hollywood. I have an office in Hollywood, right near downtown Hollywood,
Hmm.
and I work at another office in Lake Worth. It's called Palm Beach Acupuncture. I do functional medicine. I
Hmm.
do needs medicine. I do corrective exercise, and I basically offer every aspect of healing that you could possibly have aside from like dentistry and like the Western stuff.
Hmm.
Looking at everything from a holistic approach. Um, so, if you wanted to come in for like mental emotional, if you had to like rehab some part of your body, if you have pain, if you want to look at your digestive system, if you want to do your blood work. So, that being said,
Uh huh.
that little bit being said, I wish I could go further. You can reach me here on I Balance Us. That's my Instagram.
Hmm.
I have my Facebook page is a lot more active. That's Balance Integrative Medicine. It's facebook.com/BIMLLC. And you can message me there. You can message me here, whatever's easiest.
Hmm.
You can Google me. I've got a ton of reviews. You can read up on what people are talking about.
Awesome, awesome, awesome. And if anybody can't seem to find him that way, definitely reach out to me, and I can give you all of his contact information. So
I appreciate everyone listening and being patient. And you too, Seth. Thanks for your time.
yeah, of course, absolutely. I appreciate you trying to come on here and definitely and sharing your knowledge and what you've learned and what your journey's been like over the years. He got knocked out again, but I know he can hear. Um, but I really appreciate it, Illy. Maybe what we'll do is have a Zoom conversation that I'll announce, and we can have that. It doesn't necessarily have to be on a Saturday. It can just be any other time, and then I can upload it to YouTube and my website, and then people can watch it on there if they missed it on the Zoom. Gil, what did we have here? How acupuncture needles applied to governing vessel combined with moxibustion therapy significantly reduces pain levels. That, yeah, of course, I know Illy loves that question. Illy, if you want to try and get back on here and answer that one real quick, you can. Okay, we'll save that one for next time. All right, Gil. So I'm definitely gonna save that question, um, uh, and we will answer that next time for sure when I do the other call with Illy, and I will make sure I get that on the YouTube channel. The YouTube channel is called The Art of Mindful Medicine. That's the name of the show. You can also go to my website, www.mindful.doctor. So it's just mindful.doctor. And again, the show's name is The Art of Mindful Medicine. Um, you can check out all the previous episodes. The first episode with Illy and I that we didn't have any of these issues with Instagram. And if you have any other questions, like I always say, feel free to reach out to me, reach out to Illy. We'll definitely answer all of your questions, including that one, Gil, because that's a really good question. I'm always open to comments, feedback, and suggestions. They are always welcome. Like I said, check out the previous episodes on YouTube. We're going to be here on Instagram Live on Saturdays at 12. Going to try and figure out these little glitches and see what's going on. And I wanted to bring back one of my favorite things is ending every talk with a quote. So this one is by Ralph Waldo Emerson, and the quote is, "Adopt the pace of nature. Her secret is patience." And that is absolutely true. Patience is one of the secrets to life, in my opinion. So I wanted to thank you all again for coming. I appreciate you all being patient and watching. Have Have an awesome Saturday. Have an awesome weekend. I hope everybody is healthy. Yes, I love it too, John. And as always, stay awesome, stay mindful,